We spend a lot of time on these deep dives looking at data, success rates, margins, percentages, and it's easy to get clinical.
Hmm.
But the stack of papers you brought today, this feels different. It starts with a quote from a mother it just stopped me in my tracks.
It really sets the stage, doesn't it?
It does. She talks about that moment right after birth. You're expecting, the movie scene, the crying baby, the joy, the relief.
Right.
But instead, she describes a shocking surprise, a silence in the room.
Yeah.
She talks about how her other children, the baby's own siblings, were actually afraid to touch the newborn.
That is just a heartbreaking detail.
And it didn't stop there. She says neighbors would look at the baby with pity. Strangers staring in the grocery store. I mean, this wasn't just a medical issue. It was an immediate social crisis for this family.
And that is the reality of what we call giant congenital melanocytic nevi. It's a very dry medical term, but for parents, it's an earthquake. We aren't talking about a cute little beauty mark here. We are talking about a large, dark, often hairy lesion that can cover a huge part of the face or forehead.
And that's the dilemma we're diving into today, right?
Yeah.
You have this massive visual difference on a baby's face. And the parental instinct is just fix it immediately.
Of course.
But the standard medical advice, the gold standard, is basically wait and prepare for something pretty invasive.
Exactly. And that tension between the desperate desire to fix it now and the medical mandate to wait, that's where this deep dive gets really interesting.
Yeah.
We're looking at a specific case study of a boy we'll call Laurent, but more importantly, we're looking at a heated debate between surgeons about how to treat kids like him without, ruining their childhoods.
Right, because this isn't just a story about one kid. It's a clash of philosophies. On one side, you have the establishment saying, wait until age 3 for safety. And on the other, you have a doctor saying, I can do this at 3 months, and here's why you're wrong.
And the stakes could not be higher. I mean, we are talking about a child's face. If you get this wrong, you don't just leave a scar. You can distort the way they look forever.
So let's start with the status quo. I want to understand what normal looks like first. So if I have a baby born with one of these giant nevis on their forehead, what usually happens? Why is the advice to wait?
Well, it comes down to basic anatomy and physics, really.
Yeah.
If you have a giant patch of dark skin on the forehead, you can't just cut it out and stitch the edges together.
Just too tight.
Way too tight. I mean, if you forced it closed, you would pull the eyebrows way up, distort the eyelids, maybe even drag the hairline down. You'd completely warp the face.
Okay.
So you need extra skin to cover the hole. And the traditional way to get that extra skin is using what are called tissue expanders.
I've heard of these. They're like little balloons.
Essentially, yeah, silicone balloons. But, and this is the key thing, they are internal.
Okay.
The surgeon makes an incision, slides the deflated balloon under the healthy skin right next to the birthmark.
So under the normal forehead skin.
Exactly. And stitches it up. Then, over weeks or even months, they inject saline into a port to inflate it.
So, just so I have the visual right, they are inflating a balloon under the kid's forehead skin.
Correct. And it creates a mechanical force that stretches the skin, a process we call biological creep. The skin actually grows new cells to relieve the tension. It's very, very effective at creating new skin.
Okay.
But here's the problem. You generally cannot do this to a newborn.
Why not? I mean, their skin is so stretchy. I feel like babies are growing so fast, it would be easier.
The skin isn't the problem. The skull is the problem. A newborn's skull is soft. It's not fully fused or hardened yet. So if you put a pressurized balloon against an infant's skull and leave it there for months, you risk permanently depressing the bone.
You could actually dent the skull.
You could literally deform the underlying bone structure. And that is why the standard of care, and this is referenced in that Margulis paper we're looking at, is to wait. They usually won't touch a child with tissue expanders until they are at least 3 years old.
3?
Sometimes 18 months at the absolute earliest, but usually 3.
Okay, I see the logic. Safety first.
Yeah.
You don't want to crush the skull. But if you wait until 3, that kid is walking, talking, and looking in the mirror.
And that is the massive trade-off. By age 3 or 4, a child is forming a self-image. They're going to preschool.
Yeah.
Now, imagine sending a 4-year-old to school, not just with the birthmark, but with a giant protruding bulge on their forehead where that balloon is inflating.
Sounds barbaric when you put it that way.
Yeah.
We're basically giving them a horn or a massive lump to live with for months.
That's it. And the sources are very clear on this. They talk about impaired body image, social stigma, and the pain of the expansion process itself. Plus, putting a foreign object inside the body comes with its own risks.
Like what?
Infection is a big one, but also something called extrusion.
Extrusion.
That's where the balloon actually wears through the thinning skin and, well, it pops out.
Oh, no.
And if that happens, you have to abort the whole process, take the balloon out, and you've lost months of progress.
Yikes. Okay. So that's the baseline. High stakes, high trauma, potential for like a Hellboy look during the process.
Yeah.
But it works, generally.
It works. It's the gold standard for a reason.
Okay. So enter Dr. Morris Topaz in his 2020 case report on Laurent.
Yeah.
He looks at this situation, this whole waiting game, and he says, I can do this differently.
He proposes a method that just flips the script. Instead of internal expansion, he uses external traction. And instead of waiting for H3, he starts when Laurent is just 3 months old.
3 months? That seems incredibly young for reconstructive surgery.
It is. But his argument is simple. Because he isn't putting a balloon under the skin, he isn't pressing on the skull, he completely avoids the bone deformation risk.
So how does he get the extra skin if he isn't using a balloon?
He uses a device called the TopClosure Tension-Relief System.
Which sounds like a piece of gym equipment.
It's definitely more industrial than biological. Visually, imagine 2 plastic plates.
Okay.
You glue them to the healthy skin on either side of the birthmark. Connecting those plates is a strap, almost like a zip tie or a ratchet strap.
Wait, so he's essentially winching the skin together from the outside?
In a very controlled way, yes.
Yes.
It utilizes something called mechanical creep. The parents usually manage this part at home.
Wow.
They glue the straps on and tighten them gradually over the course of a week leading up to the surgery.
That sounds, well, intense for the parents. I mean, you're acting as your own child's medical technician.
It puts a huge amount of agency in the parents' hands. But interestingly, the report notes that because the tension is applied so slowly, it's not painful. There's no anesthesia required for the stretching phase.
So they stretch the skin to get some slack. Then what?
Then surgery. They go in, cut out a portion of the nevus, and because the skin has been pre-stretched by these straps, they can pull the edges together and stitch them up.
Okay.
But, and this is key, they don't get it all at once.
Because the birthmark was huge, right? The notes say 8 by 10 centimeters.
Yeah.
That's like a grapefruit on a baby's forehead.
It was massive. So they did this in cycles. 6 cycles, to be exact. Stretch, cut, stitch, heal, then repeat.
That seems like a lot of surgery for a baby. 6 times under the knife.
It is a heavy burden. I don't want to minimize that at all. 6 surgeries is a lot for anyone, let alone an infant.
Yeah.
However, consider the timeline. They started at 3 months. They finished the entire reconstruction before Laurent's 2nd birthday.
So by the time he's 2 years old, the mark is gone.
Completely excised, no balloon head, no preschool bullying. He enters his conscious life with a normal forehead.
That sounds like a total slam dunk. If you can skip the balloon and the waiting, why isn't everyone doing this? Why are we even discussing a debate?
Because plastic surgery is as much about art as it is about science, and different artists have, different philosophies.
Okay.
And frankly, because new methods are always met with skepticism, in 2025, a group of surgeons, Margulis, Billig, and Adler, published a paper. Now, they were primarily writing about nasal reconstruction.
But they took a little detour, right? I read that section. They seemed to go out of their way to talk about Laurent.
They did. They referenced the TopClosure method and Laurent's case specifically, and they acknowledged that the device closed the wound, sure.
Right.
But then they dropped the hammer. They claimed it did not produce sufficient supple skin and ended up distorting key facial landmarks.
Distortion. In, like, lay terms, they're saying Dr. Topaz messed up the kid's face.
Essentially, yeah. They're implying that because the skin wasn't expanded enough, like it would be with a huge balloon, the tension pulled the eyebrows up or twisted the eyelids or warped the hairline. In facial reconstruction, symmetry is everything. If you remove a mark but leave the patient looking permanently surprised or lopsided, that is considered a failure.
That is a serious accusation. You're basically saying, sure, you got the spot off, but you ruined the canvas.
It cuts to the absolute core of a plastic surgeon's reputation.
So, who is right? You have the original doctor saying success, and these critics saying distortion. It feels like a he said, she said situation.
This is where the scientific process gets really fascinating. Dr. Topaz didn't just let that comment slide. He wrote a formal letter to the editor in 2025 to rebut their claims. And his argument was simple. You are judging the process, not the result.
What does that even mean?
He suggests the critics might have seen photos from the intermediate stages. Remember, they did 6 surgeries.
Right.
So if you looked at Laurent after surgery number 3, yeah, his eyebrows might have looked tight or a little pulled. The skin was under tension. It hadn't relaxed yet.
It's the old trust the process defense.
Exactly. Topaz argued that the critics failed to account for stress relaxation, the skin's natural ability to stretch and relax over time. But he didn't just argue with words. He brought receipts.
This is the part of the deep dive that really got me. I love it when people bring evidence.
So in that 2025 letter, Topaz included a follow-up photo of Laurent, not at age 2, but at age 10.
8 years later, that's the gold standard of evidence, isn't it? Long-term follow-up.
It is. In pediatric surgery, growth is the great revealer. A scar that looks good at 2 might stretch and look terrible at 10. Or a face that looks symmetrical as a baby might grow crooked if you've messed with the underlying structure.
So break it down for me. What does Laurent look like at 10 years old? Does he have the distortion they claimed?
According to the photographic evidence and the report, the outcome is excellent. The hairline is normal. The eyebrows are symmetrical. The eyelids function perfectly. The distortion the critics warned about, it's simply not there.
That's incredible. It really highlights how dangerous it is to draw conclusions from a snapshot in time.
It is.
If you'd listened to the critics, or just read that one Margulis paper, you'd think the method was a disaster.
Precisely. You would have dismissed a valid treatment option based on an assumption. And this friction between the 2 papers is actually good for medicine. Margulis isn't a bad doctor. His paper makes totally valid points about nasal surgery.
Right, because the nose is different, isn't it? It's all cartilage.
Exactly. You can't just pull nose skin tight. You'll flatten the whole nose. So TopClosure might not be the best choice for the tip of the nose, but Margulis tried to apply that same skepticism to the forehead, and the long-term data proved him wrong, at least in this specific case.
It also validates the biomechanics, doesn't it? The whole idea that the skin will relax if you just give it time.
Yes. It proves that stress relaxation actually works. The skin is a dynamic organ. It adapts.
But I want to go back to the human element of this. We talked about the physical result. The face looks good. But that Topaz paper emphasizes something else that I think is even more important for the parents who might be listening. The memory gap.
This is, in my opinion, the most profound takeaway from the whole thing. The paper explicitly states the child has no recollection of the reconstructive process.
Because it was all over before he could form long-term memories.
Exactly. I mean, compare Laurent's experience to the standard approach. A child undergoing tissue expansion at age 4 or 5 remembers everything.
Oh, yeah.
They remember the hospital smell. They remember the needles. They remember the other kids staring at the playground. They remember the fear. That becomes a part of their identity.
And Laurent.
He just knows he has a faint scar. His mother said he grew up with a normal childhood. He avoided the trauma entirely. He doesn't have a before and after in his head. He just is.
That feels like a metric we don't track enough in medicine. We measure blood loss, we measure infection rates, we measure scar width, but do we measure trauma avoided?
We really don't, and that's why this approach is so disruptive. It challenges the standard of care not just on mechanic straps versus balloons, but on psychology. It suggests that when you operate is just as important as how you operate.
It does create a tricky decision for parents, though. On one hand, you have these standard balloons. It's been done thousands of times. It's safe, predictable, but traumatic.
Right.
On the other hand, you have this strap method. It's newer, it requires you to actively participate, but it offers this incredible psychological upside.
It's not an easy choice. And to be fair, the TopClosure method isn't magic. It requires compliant parents.
Compliant, meaning they actually have to do the work at home.
Right. If the parents don't tighten the straps correctly, or if the device pops off and they don't fix it, the surgery fails. The balloon method relies on the doctor doing all the work. The strap method relies on the family doing the work.
That's a really important distinction. It's a partnership. You can't just drop the kid off at the hospital and pick him up fixed.
It really is. But for the family, in this case, Study Laurent's family, that agency was a positive thing. They felt like they were doing something to help their son rather than just sitting around waiting helplessly for 3 years while this mark grew with him.
So, if we zoom out, what is the lesson here for someone listening? Maybe they aren't a plastic surgeon. Maybe they're just a parent trying to navigate a scary diagnosis like this.
I think the lesson is to question the wait-and-see approach. In medicine, we often delay treatment to minimize physical risk, like the risk to the skull bone we talked about.
Sure.
But we rarely calculate the cost of that delay on the patient's mind. on their psyche.
And to look for the long-term data.
Absolutely. If a specialist tells you, oh, that new method doesn't work, ask them for the evidence. Are they basing that on theory? Or are they looking at 10-year follow-ups? Because as we saw with Laurent, the theory said distortion, but the reality was correction.
It's funny. Usually when we see these academic fights, it's just ego. But here, the friction actually created light. The debate between these doctors eventually gave us the proof we needed.
It did. And now, because of that debate, other families have a genuine alternative to the balloon. They can point to Laurent and say, look, it worked for him.
It's a fascinating look at how innovation actually happens. It's messy, it's debated, sometimes sharp-elbowed, but ultimately driven by trying to give a kid a better life.
Couldn't have said it better myself.
I'm going to be thinking about that memory gap for a long time. What other problems could we solve before they even become memories? That's a heavy thought to leave you with. Thanks for diving deep with us today.
Always a pleasure.
Check the show notes for the papers if you want to see the photos yourself, especially that 10-year follow-up. It is really worth a look. Stay curious, and we'll catch you on the next one.